To move the motion.
I'd like to thank members for coming along to this really, really important debate on a subject that I know is filling up all of our inboxes. Government support for education, health and care plans, or EHCPs. What do we mean by EHCPs? For the benefit of anybody watching this back who may not understand the system, EHCPs are a fundamental part of the special educational needs system. They are the thing that are responsible for providing the additional support that children need in schools to help support them through their educational life and beyond as well. But there's a big problem with them. Children and parents are not getting the support that they need through the EHCP system, and even when they are getting EHCPs, when they are granted EHCPs, those EHCPs themselves are sometimes not being delivered. So even when the support is set out in them, then the schools are unable to deliver them, and parents are ending up in this ridiculous situation where in many cases they're having to take their local authorities to court, and then the local authorities are losing 99% of cases. But it's delaying and delaying and delaying and costing parents a huge amount of money and costing local authorities a huge amount of money. So what do I mean? Well, on the 3rd of September last year, the government published local authority level figures for the actual waiting times for a decision following an education, health and care needs assessment. So that's the first stage. So a parent applies for what's an EHCNA, a needs assessment, and then the local authority has 6 weeks to decide whether they're going to do that, and then 20 weeks in total to issue the EHCP. So how long are people actually waiting? Well, there are huge discrepancies across the system. So Hampshire, for example, Hampshire County Council is issuing its EHCPs within 20 weeks, 75% of the time. So that doesn't sound too bad, right? Essex County Council, where I'm situated, they are issuing their EHCPs 0.9% of the time within 20 weeks.
So does she agree with me that the said system is failing families? We can't have a sticky plaster solution, and what we need is a root and branch review.
Wholeheartedly agree with them. It is a completely broken system, and that means complete reform. But I would just gently say, the longer that reform takes, the more harmful it will be for children. Yeah. There are children right now who are suffering because they're not getting the support they need. And children keep getting older. They don't wait for governments to decide what they're going to do. They don't wait for root and branch reform. They need the support right now, and parents need the support right now. So while I absolutely welcome a whole-scale review of this and whole-scale change, there are things that we could do to alleviate the problems now, and I really would urge the government, if the Minister takes nothing else away from this debate, I hope that she will take away the plea that we do more things now, that we speed up some of that reform, some of that implementation now, because there are things which I'll come on to in a bit about what we could do.
Does my honourable friend agree with me that we must tackle this postcode lottery to urgently provide better support for some of our nation's most vulnerable pupils?
Of course, and my honourable friend raises a really, really important point, because of course we must tackle this inequality, and I know that the government will turn around and say, well, we've put £1 billion extra funding into special educational needs, and that's great, that's very welcome, and it's much better than no extra money into special educational needs, but unfortunately it won't touch the sides. Local authorities are saying that they have a deficit in the high needs block of £3 billion, and that's estimated, some estimates say that's going to go up to £8 billion in the near future. So we really are looking at a massive funding shortfall on this.
My honourable friend agree that in order to have improvements in EHCPs, we need to regain, first of all, the trust and confidence of parents.
Trust of parents is really, really important in the system, and important to be able to take this forward. So we need to show that we are listening to parents. But we also need to show that we're giving parents the information they need to alleviate their stress, for example. When you have a child with special educational needs, you know that they need extra support. That it's already a very stressful time in your life, and then to sit there waiting for an EHCP to land in your inbox, or maybe week 19, because it's supposed to be 20 weeks, so of course it should land in week 19, and then it doesn't turn up, and it keeps on not turning up, is incredibly stressful and takes away parents' trust in the system. So we should be doing more to be more transparent about that. And we talk about 20 weeks it being issued in, but actually across England as a whole, 37.4% of decisions took 6 months or longer. I mean, that's just a ridiculous figure. 5.7% took a year or longer, and I think that's just completely unacceptable, and leaves parents in a very difficult place, and we need to be more honest with parents and make that information much more available to them. I'm just going to trail my amendment to the Children's Wellbeing and Schools Bill, which actually would help to make it much more transparent for parents. Just telling them if local authorities had to publish how well they're performing against those statutory deadlines, I think it would be much better for parents, and my amendment, New Clause 3, seeks to do exactly that. So what is the impact on children? Because we must remember that these are not just random numbers that we're talking about. These are not just figures in a spreadsheet somewhere. These are real children who have real lives and real parents and, and real families, and they have aspirations in life as well, and we need to support them. So what does it mean for them? Well, a SEN professional wrote to me. They gave me a case of a child, they said, who is autistic, non-verbal, and has sensory processing challenges. They applied for an EHCP in October 2023. It is now January 2025, and they are still waiting for their EHCP to be issued. In the meantime, they are placed in a mainstream school with no tailored support. The result has been incredibly stressful for the child, their family, and the staff working with them. The school has now reached a point where they cannot cope, and the child is being homeschooled, isolated from peers, and without access to the specialised education they need and deserve. Another Senko, who's also a teacher, wrote to me and said, "It's very frustrating the length of time it's taking for EHCPs to be finalised. Although they are backdating the funding, which is great, by the time the EHCP actually is agreed, it is often too late for parents to request school placements ready for a transition at the start of the school year, which is often what we need the EHCP for in the first place." And there is this preference for mainstream. I hear the government talk about it, we should be educating as many children as possible in mainstream, and I don't fundamentally disagree with that, except that mainstream isn't suitable for all children, and certainly when mainstream schools do not have the resources that they need to be able to provide that education and that support. It does sound good in principle, but Contact, who's a charity for families with disabled children, wrote to me and they said, local authorities like Essex, again where I am, are reducing the provision in Section F for a child with an EHCP, as they believe that a lot of the provision in Section F comes under ordinarily available provision, which they say the school can provide as standard. All the special educational provision that a child with an EHCP needs is legally required to be stated in Section F of an EHCP. It is through Section F that there is a legal duty for local authorities to make this provision. Parents have been told by schools that there is no funding for SEND provision or ordinarily available support. How can children be reliant on SEND support when there is no funding for it? So schools are really struggling to keep up with this. This idea of mainstream ordinarily available is great, but not if the schools aren't provided with the funding that they need. And I know the government could say, well, we've increased the funding for schools. So, yes, but they've also increased the funding they've also increased teacher pay, which is great. Teachers absolutely should be paid more. But they've told the schools that the teacher pay needs to be funded out of the school's budget, which makes it very difficult.
Does she not agree with me that not only are many rural areas underfunded as far as the support they get, but also that they face the additional challenge of expensive home-to-school transport as well to get to that specialist provision, and there's insufficient budget for that.
It's really important. Now, I don't live in a rural area, so it's easy for me to overlook these issues, but I do know that this is something that many councils have been raising as an issue, and indeed Essex County Council, to be fair to them, have also raised it with me. When we talk about a root and branch reform of this system, we need to make sure it is the whole system and everything that goes with that, including this, the transport issue. So what is the impact on the school budget? So one primary school is funding 90 hours of learning support assistant time, LSA time, a week, because there is no EHCP and they're having to find that out of their own budget. And that's through not a lack of trying, because for a particular child, they said they applied for an EHCP in January 2024, and that child's not even seen an education psychologist yet. They tell me that they don't have the buildings and the resources to be able to safely look after the children.
Does my honourable friend agree that funding needs to ensure provision is local, meet needs, and is well resourced?
It's very hard to disagree with that point. Of course, it needs to be. It needs to recognise what the local challenges are, and the local challenges are different in different localities. Going back to this issue of LSAs and the support that they provide in school, there are often several children in a class with EHCPs, and so therefore sometimes you need more than one LSA to support them. But it's hard to recruit LSAs because, as schools tell me, the salaries don't match the skills that are required for the LSAs, and also it's not suitable. In all cases, because young people with severe special educational needs can be really through no fault of their own, I just want to be very clear, but they can be very disruptive. And they can, unfortunately, endanger other children if they aren't properly supervised, which is why it's really important that we have these LSAs and teaching assistants and all the support staff that we need to support these children. One SENCO told me, as much as the LA say children don't need one-to-one support full-time, there are some children that really do require one or sometimes two adults with them throughout the day if everyone is to be kept safe, for the child to have their self-care needs met in a mainstream environment. We talk a lot about schools, but this also affects further education as well, sixth form colleges, for example, and they tell me too much focus on the annual reviews that are done as part of the EHCP process is focused on education attainment and the progress that's been made through academic achievement, when in fact the colleges need to understand what special measures they need to put in place to prepare to best meet the needs of the children that are coming in, and that isn't necessarily about academic achievement. That is about how can they best manage the behaviour that they're exhibiting, how can they keep them safe, and they say that unfortunately EHCPs don't place enough emphasis on behaviour, and therefore they have a plea, and I hope the Minister is listening, that if we're looking at the EHC process, that we encourage focus on that as well and not just education attainment. And also they say that some information in the annual review about behaviour is historical, which might put the sixth form colleges off from accepting those pupils, when in fact it would be perfectly appropriate because they could be supported because their behaviour has now changed and they can support them in different ways. I also want to say something about early intervention, about how important that is. Addressing issues early on is really, really key. Some children won't need this support throughout their entire life. They may not need it through their entire school life. But getting in early, so especially speech and language issues, some of those can be helped really early on, and then once those are made better, then the children can progress just as well as they would have done without, for children who haven't needed that additional support. So it's not just about necessarily always about long-term support. Sometimes it's about just early intervention, and then we can save money later.
It's good to hear yesterday from the APPG on SEND about the importance of early intervention, so we could work together on improving outcomes for parents, kids in Colchester and Chelmsford.
Of course, I would be delighted to work together on that sort of issue. And that issue of early intervention, I'm glad she raised it, because actually at the APPG there was an example that was given to us of somebody, of a child who had, in this instance had selective situational mutism. That was a particular example that was given. And the intervention that they received really early on then meant that they were then able to progress and achieve their full potential, which I thought was fabulous. And unfortunately, I have exactly the opposite example in my own constituency, where there was a child with selective mutism who didn't receive that support and is now actually not in school at all. The importance of that support cannot be overstated. We could talk a lot about why there have been an increase in EHCP applications. We could talk about COVID and its impact, the lack of socialisation. We could talk about the increase in, what that's led to. We could talk about lack of early intervention, and maybe some parents are asking for EHCPs as the only way to get the support that might otherwise have been ordinarily available, because schools are feeling the pressure so much. But ultimately, this is a systemic failure, and I just want to very quickly move on to some solutions, because I think one of the things that we really need to talk about, other than root and branch reform, and again, this is about doing this quickly, and remembering that children are growing up every single day without that support is another day when they are suffering. But we need better communication. We need communication between schools and colleges. We need better communication between local authorities and parents, between schools and parents. The list could go on, but I just want to remind everybody that communication is two-way. It's not just the local authority sending out a briefing pack. That's not good enough. We need them to be listening as well, and we need the government to be listening. We need more training. We need qualified and experienced people working with children. As a qualified and experienced SEND professional told me, people like me who are trained to work with SEND children and adults often find there is no structured role for us within councils or government systems to support schools, families or nurseries effectively. We need to be doing more about this. People who are willing to work and want to work and have amazing experience in the system, let's help them get those qualifications to help us and for them to be able to help parents and young people as well. And as SENCO said, we need, as SENCOs, more career path options. Could we have an option, for example, to fast track some training? Could there be some kind of associate ed psych qualification? I don't know, but maybe these are things that that could be looked at. And we need to make it easier for parents to understand what's going on. Back to this issue of tribunals, when local authorities are losing 99% of cases, something is seriously wrong. And I wonder whether some of those delays that the local authorities are deciding to take parents through all the way to tribunal is, if I'm being very cynical, a way to avoid having to pay the costs of providing the support to the children during that time. Welcome the Education Select Committee's inquiry on solving the SEND crisis. Minister, if I may just say, we really do need some action now. So I would just urge the government to work on what steps they can take right now to make children's lives better, because at the end of the day, this is about supporting children's futures. This time last year was about almost exactly the time when I first heard about this subject, as in the terrible state that special educational needs was in, because a parent raised it with me and they told me what was going on. At that time, when I started digging into it, parents just did not feel heard. They felt that nobody was listening to them. So I would just like to say to any parents, anybody involved in education who has been battling this at the moment, I think you can see by what's happened here today that we are listening now, and we will keep holding the government's feet to the fire and making sure that they make progress, which I very much hope they will. And indeed, I have faith that they do indeed want to make progress. So thank you very much for being part of this. I hope we make progress very soon.